Speaker of the National Assembly, honorable members, members of the media, and visitors, good afternoon to you all. Today, I rise to join my colleagues on this side of the House to register my disappointment at this $552.9 billion budget under the theme, steadfast against all challenges, resolute in building our one Guyana. This budget, which is the same as two previous budgets, except that this current one has seen an increase of 44% more than the former, and has capitalized on monies from the Natural Resource Fund, NRF. This budget is dismal, unexciting, unstimulating, insensitive to the needs of the average citizen. It is anti-poor, heavy on infrastructure, but light on people's welfare. And there is the absence and lack of evidence of strategic medium to long-term planning. This budget is a wish dream, but wishes do not catch fish. Our people need land, housing, jobs, and fundings available for investing in entrepreneurship for the next generation. Mr. Speaker, the budget contradicts reality. In listening to the minister as he read the budget, I was wondering if I were listening to a version of some fable. The Honorable Member Ashley Kumar Singh tells stories that can be amusing but unreal. In paragraph 1.3 of his budget presentation, the minister said, where there was once economic contraction, there is now economic expansion. And where there has been job losses, there is now job creation. Quote, open and close quote. In the typical characteristic of the fable, its remarks on occasions veered from reality. For example, in talking about economic contraction, Kumar, the honorable member, did not tell the Guyanese that the last time the Guyana economy contracted, it was under the PPPC government. And that interestingly, the honorable member had been a part of that regime. And what the honorable member did not say about unemployment was that when the coalition was in government, unemployment was as low as 12.8% in the first quarter of 2020. No one must take my word for it. A look at the Guyana Labor Force Survey, as published by the Bureau of Statistics, has indicated that the unemployment rate was over 15% at the last report in 2021. Yet the honorable member stands before the National Assembly and says that there is job creation. My math tells me that 15 was greater than 12. So to me, that shows contempt for the people of this country. So the budget contradicts reality. This budget is full of exaggeration about the accomplishments of this government. The honorable member, the senior minister in the office of the president with responsibility for finance, speaks to the growth rate of the non-oil economy. The largest growth rates are found among the smallest industries in the economy. Mr. Speaker, that is the only part of the issue. One of the largest growth rates is found in the accommodation and food industry. And this growth is a direct result of the demand coming mainly from the oil and gas industry. Therefore, it has absolutely nothing to do with any policy of the government. That industry will grow if the oil and gas production increases. Further, 5 of the industries with the highest growth are so small, Mr. Speaker, that collectively they account for about 2% of the economy. Under the same section, paragraph 1.3, Mr. Speaker, it is interesting that the minister would stand and talk about democracy in the same paragraph and stated that within the last 18 months, democracy has prevailed. I am tempted to ask you, Mr. Speaker, if these words, though they may not be unparliamentary, should not be expunged from the record of this National Assembly. As you may be aware, Mr. Speaker, that none of the persons leading his party were democratically elected. We had elections the other day. They were handpicked. Yet the honorable member stands in this noble assembly with a straight face and tries to lecture to my party about democracy. The advice to be given would be that the members of his party must first practice what they preach. Mr. Speaker, while actively championing local content provisions for local companies, this government has been actively blocking other local businesses from enjoying economic freedom and competing in their own economy. With this practice, the promise to ensure Guyanese businesses can compete successfully under the new local content framework is biased and rings hollow. Local content, therefore, means nothing. If a government decides who should participate in the economy and who should not, well, this act is despicable and must stop now and must go. Mr. Speaker, please permit me for a while to highlight some of the recommendations of the APNU-AFC coalition detailed to ensure development should not only mean an increase in material wealth for a particular section of society, but must include the welfare of the entire populace. As an oil-rich country, we are saying that poverty among our citizens should end forever in Guyana. The question to be asked, Mr. Speaker, would be, what is this regime comprehensive anti-poverty strategy based on the fact-finding National Poverty Survey? And how do you plan to lift the working poor out of poverty and misery? Mr. Speaker, the Honorable Minister Ashley Kumar Singh has claimed that there has been more disposable income to the populace, but has failed to explain the difference between disposable income and purchasing power. We on this side of the divide are saying to you, sir, to conceive of work-paying initiatives. We are giving the goodly minister a few recommendations because you claim we come here without recommendations. So that in his wrapping up, he will tell this noble assembly that these important revisions would be made. We are saying to him, be bold. Confront these challenges steadfastly as you make the necessary adjustments to the budget before its passage to this noble assembly. Mr. Speaker, as an oil-producing state, we are positing that as the minimum, there should be 25% salary increase for all public servants stat. Let there be no taxes on the minimum wage, which should be no less than $125,000. Yes, Mr. Speaker, and using the colloquial parlance, we are an oil-producing state. When compared to the sister CARICOM countries that just export banana or rely on tourism. Mr. Speaker, Guyana has been blessed with a plethora of oil finds, with gold, bauxite, manganese, sugar, plus the non-oil sector, such as forestry, fishing, the other mining and quarrying subsectors, comprising of diamond and sand and stone mining, and according to the minister, an upward trajectory. Therefore, let the minimum wage increase even more, maybe to 130,000 in the pockets of the citizens. Number 3, let the tax threshold be equitable and fair. Can we do it, MPs? Yes, we can, honorable members. The APNU AFC coalition further recommends that a people-centered approach be considered to include a credit earned income tax credit to improve the life and livelihood of the elderly, the disabled, and home-based caregivers. Mr. Speaker, page 17, section G, 3.46, talks about the prudent debt management of this regime. Hence, there should be enough fiscal space to accommodate and to assist the poor and vulnerable. Mr. Speaker, there must be a people-centered vision. Yes, a focused approach while addressing Guyanese with varied circumstances. The low-income families, children in single-parent homes, frontline workers, and the residents in the hinterland communities, among others. At number 5 in our recommendation, Mr. Speaker, the APNU AFC coalition is requesting that there be small business grants of up to 5 million per business. In other words, no Guyanese must be left behind. I reiterate that the goodly finance minister, the honorable member, should give clarity to the Guyana populace and let the Guyanese citizen know that though in his presentation of this budget 2022, the honorable member sought with great effort to allow for an improvement in disposable income, which is good, but the truth is that the honorable member has now realized that many persons would not have any purchasing power. And it is not too late, sir, to fix this anomaly. In addition, the APNU AFC coalition supporters asked me, they want to know what the financing priorities of the National Resource Fund, the NRF, what are they? What are the priorities? And what are the projects to be financed using this fund? Since none has been identified. Mr. Speaker, I have noticed that the honorable ministers emphasize the one Guyana concept. I'm assuming that the honorable member is aware that Guyana's motto reads one people, one nation, one destiny. However, as the minister strives to build this oneness, the honorable member has not been steadfast in addressing the challenges of a section of the populace that still has pink slips from the COVID-19 grant rollout, or the portion of persons who are unable to obtain the much needed flood relief. It is our wish, Mr. Speaker, to hand over the list of the names of Guyanese who were unable to obtain such grants soonest. Mr. Speaker, at the end of 2025, what will Guyana look like? What will it be like? Mr. Speaker, in this budget, there has been no evidence of the use of the logical model. Come on, Finance Minister. What are the performances that are being evaluated? There is no evidence of outcomes and data to support the outcomes. Mr. Speaker, as this budget agenda skips and flips, yet our people need a budget that fits. How are the people in the hinterland going to benefit from taxpayers' dollars? Mr. Speaker, I must turn my attention to the health sector. Investing in our people. Section 4115. It talks about leveraging public-private partnerships. However, the Ministry of Health, MOH, currently does not have the technical infrastructure frank, honorable member, to be stored over such highly complex partnerships, which often involve performance-based contracting. The evidence under the PPPC in 2011, while the present Minister of Health was garnering no experience in healthcare leadership, as he was the Minister of Youth and Sport and Culture at the time, his current advisor failed to successfully administer a service level agreement between the Ministry of Health and the Linden Hospital Complex. This led to the PPPC giving up on further use of such complex health financing method between the two entities. Mr. Speaker, the greatest risk with public-private partnerships is that if the contracting ministry or agency does not have the ability to administer and monitor such partnerships, then the service provider would be placed in a position where the Ministry of Health could be easily fleeced. And in healthcare, this would mean delivering less health services with poor quality for higher prices, with a spin-off leading ultimately to a greater number of untimely deaths, disabilities, and illnesses from disease complications, thus increasing the morbidity and mortality, which becomes a public health burden. At 4116, an allocation of $73.2 billion is earmarked to be spent to achieve the outcomes for the intervention to modernize the health sector and manage the pandemic. However, the Ministry of Health has failed to produce any consolidated report that would identify the results achieved from the expenditure of their 2020 and 2021 budgetary allocations. Thus, it is not advisable that the Parliament should increase the Ministry of Health budget by over 36.8%, $19.7 billion, when they have failed to demonstrate in a clear and data-driven way the outputs, the outcomes, and impacts of past allocations. Budgets must be results-based, performance-focused, and it has been alleged that the Ministry of Health in this regard has no proven track record over the past year. Facilities and equipment, 4117. Mr. Speaker, the flagship spending of the sum of $2.3 billion in 2022 to modernize and expand facilities, including the Festival City, Polyclinic, Diamond Diagnostic Center, and Latham Hospital, are undertakings that were piloted by the APNU-AFC coalition government during our term of office. The PPPC merely inherited these projects that were in their final stages. It is our wish on this side of the house, of the divide, that these projects be completed at the shortest possible time. The Honorable Senior Minister Kumar, with responsibility for finance in the Office of the President, has reported that the sum of $19 billion was expended for the purchase of medical and non-medical equipment. But here we stand again with no results or performance measures from the Ministry of Health on the outcomes and impacts of this investment. In our quest to demonstrate best practices, and according to Diacono et al. 2017 in the article titled Globalization in Health, we must be wary of a medical device and equipment that are unfit for purpose. The authors further stated that undiscerning procurement processes are at the heart of this issue. Some questions to be asked, Mr. Speaker, when considering facilities and equipment are or include: what percentage of the items were delivered on time? What percentage is operational? What was the lead time between their delivery and operationalization? How many people benefited and in what way? How was this investment impact the lives of the ordinary Guyanese? Are Guyanese healthier with a better quality of life? The Honorable House should be expected not to give monies for which the returns are not adjudged. 4118 section. Note is made of the need of additional regional hospitals. However, these additional regional hospitals must be built in areas where they could facilitate access to care and impose minimum geographic hardships for the admission for the least number of persons. Regrettably, we are unsure if this is the case for the proposed regional hospitals to be built and to be constructed at Anna Regina, Tushen, Enmore, Bath Settlement, and number 75 Village Quarantine. What about Buxton on the East Coast? What about Mahaika? To our minds, this singling out of locations based on voter population should be disallowed, as it would be a clear violation of the constitutional rights of all to access health care services under Article 24 of the Constitution. In addition, it bars Guyana from achieving the goal of health for all people everywhere, that is universal health care coverage. Health should not be politicized, and thus the location for the hospital must not be determined if the area is PPPC or APNU, stronghold or not. Thus, we ask for the evidence that justify the selection of those sites. In addition, Mr. Speaker, according to the honorable member, these regional hospitals on page 48 are expected to catapult healthcare delivery beyond current levels. The West Demerara and Bartica regional hospitals are slated for upgrades. So a relevant question would be, Mr. Speaker, if these regional hospitals have problems, West Demerara and so on, with human resources and remuneration for healthcare workers, where shall and in what way shall the regional hospitals at Anna Regina, Tushen, Enmore, Bath, number 75 appear? 4119. There has been the proposed expenditure of $359.3 million for laparoscopic surgical equipment for GPHC. Of course, the provision of surgical care is essential to public health, though the prominence should be on primary care and preventative medicine. That is where the effort should be. But we know the new emphasis now is on procedures and dollars. However, the spending of $359.3 million for laparoscopic equipment for GPHC needs to be justified. Across Guyana, people face great challenges in accessing essential surgical services. And for Guyana to meet this challenge, according to Vancel et al., there needs to be approximately 10 fully equipped such devices and well-trained staff operating theaters per 100,000. So while currently we only have about 2 per 100,000 population. Therefore, to enhance our National Referral Hospital by providing laparoscopic surgical equipment at the cost of $359.3 million would not meet this challenge. Rather, this move would only serve to widen the disparities between the demand for surgical services and the supply of infrastructure along the hinterland and coastland divide. In addition, significant disparities along ethnic lines at surgical department at GPHC and within the surgical training program need to be addressed, Honorable Member and the Minister of Health. You know, these folks tell me these things, and I think this is the forum for me to tell you. It has been alleged that young Black doctors who are aspiring to be surgeons are unlikely to get into surgical residency program, not because of a lack of intellect, but because you might not be of the right race. To this end, and to comfort and remedy this situation, we are asking for a race disparity and remuneration audit into the admitting of residents and the hiring of registrars, be it junior and senior consultants. Mr. Speaker, as the Shadow Minister of Health, I'm going somewhere, and I'm telling it as it is, like I feel it, because of a certain section of the populace. Section 4120. Human resources constitute an important health system component as the work done in the sector is performed by and for the people. On average, 50% of health expenditure should go towards the health workforce. This would require approximately $36.6 billion out of the proposed $73.2 billion to be spent on those directly engaged our healthcare workers. However, summing up in the distribution of the proposed allocation for the 2022 budget, $47.34 billion will not be spent on healthcare workers. So we asked the government side of this House how much of the remaining $25.86 billion will be allocated on our hard-working healthcare workers who have toiled so hard during the pandemic, risking not only their lives, but that of their families. Is there any mercy, understanding, and reward for our healthcare workers? Health workers are long overdue for a meaningful salary increase and risk allowance. Also, it would be timely now to review the on-call rate, with a view of increasing same. Some it's 4,000, 5,000, maybe Diamond and Georgetown is different. And the uniform allowance, the on-call, risk allowance. So if you can look at that, maybe move it from 20,000 to 50,000. So you can address that, Honorable Minister. 4121. The performance of health services is not determined by solitary numbers of a simple count of the person screened for just one major cause of disease burden, as presented by the Honorable Senior Minister with responsibility for finance. The performance of health services is measured by health outcomes and the impact of those outcomes. Hence, the APNU AFC Coalition would like to see soon the scaling up of the diabetic clinic, not only at Lusignan, but throughout the administrative regions. And just to remind the Health Minister, Dr. Frank Anthony, the Honourable Member, of some examples of some performance indicators we on this side of the Assembly are talking about. It's not just like that, we're just talking wild. And these indicators include, but not limited to, the percent of children under 5 with acute respiratory infection taken to a health facility, the unmet needs for family planning, knowledge, attitudes, and practices regarding key health issues and services, the percent of women who seek care for specific health intervention by source and income group, life expectancy at birth, the existence of other processes of assuring quality of care besides supervision, the maternal mortality rates, the under 5 and neonatal mortality rate, the existence of national COVID-19 plan, just to name a few indicators. The acquisition of 2 ambulances, 4122, for emergency use is unable to adequately bridge the gap in emergency medical services. The people of Guyana need more, such as a trauma center in Region 4, and an ambulance service that extends beyond Lillian-Dahl on the East Coast and Agricola on the east bank of the Marara. Also, the accident and emergency rooms across all our regional and district hospitals need to be adequately equipped and staffed. More so in the hinterland, where access to the National Referral Hospital poses a significant challenge. Access poses a significant challenge. Mr. Speaker, given Medivac by air is a significant consumer of health expenditure and critical to the saving of the lives of our brothers and sisters in the hinterland, there is a real need to explore a government of the Guyana Air Ambulance Service. And looking at emergency medicine, Mr. Speaker, the APNU AFC Coalition recommends the building of a level 3 trauma center, which would be essential because of an increase of oil and gas companies and the fabrication of heavy duty machinery. We must be prepared for mass casualty, God forbid. Mr. Speaker, the members on this side of the National Assembly are saying that with the emerging oil economy, there must be a strategic shift into a new approach, a fresh approach is needed. No more working in silo, but working together with a sense of integration, considering human capital and intersectoral linkages for growth and development. Mental health, 4123. The global experience has taught us that medicating and hospitalizing persons with mental health illnesses should not be an option or should be of last resort. Leading scientists and international organizations concerned with health, such as the World Health Organization, WHO, have recommended that countries shift away from institutionalized care for mental health. I have been advised, Mr. Speaker, that currently 10 to 15% of Guyanese have experienced some form of mental illness at one time, and more so in this COVID time. And 3 to 5% have a chronic mental disorder, according to the Government Information Agency, February 2017. Additionally, it has been noted by those who are engaged in research that unipolar depression stands as the 5th largest contributor to disease burden in Guyana, with approximately 20,000 Guyanese suffering from severe mental disorders. That doesn't include mental retardation, alcohol abuse, and epilepsy.
Honorable member, your time is up. You will need an extension.
Thank you. Comrade Chairman, I move that the honourable member be given 5 minutes to conclude her presentation.
Thank you, Honorable Chief Whip. Honorable member, you may continue.
Thank you, Mr. Speaker. Thus, given the substantial real need for mental health services as evidenced by the above statistics, the relatively high costs associated with the provision of comprehensive mental health care, the $538 million that have been allocated to procure drugs and to augment mental health would be insufficient. And in fact, would only serve to strain the health budget with no real improvement of the mental health of Guyanese. To date, Mr. Speaker, the Ministry of Health has failed to produce any report, as I mentioned before, on the COVID-19 pandemic, showing the competent handling and management of the public health threat. Under the PPBC, Guyana has seen the highest recorded cases of infection each day and month. Guyana experienced 2 deadly waves of COVID-19, each more deadlier than the other in 2021 and 2022. To date, the death toll stands at a whooping 1,176 deaths, confirmed cases 60,385, with 8,399 Guyanese on home isolation. Thus, even $6.8 billion have been allocated in the 2022 budget. We must be assured that the PPCC will utilize the resources effectively. The AP&UAFC coalition firmly believes that there should be an assiduous effort to train traditional birth attendants and also boost the single-trained midwives program to provide better outcomes for mother and child so as to achieve the global maternal-maternity ratio and the child mortality ratio and the neonatal mortality ratio. Mr. Speaker, the maternal waiting homes at Maruka, Cato, and New Amsterdam, this project had begun under our stewardship, and it is our wish that tireless efforts would be made for the completion of these waiting homes to ensure that there is zero maternal, child, and neonatal mortality. The AP&UAFC coalition looks forward to a reduction in teenage pregnancy as part of a comprehensive program in our schools across Guyana, where they would be adequately and accurately counseled, even in the context of peer interaction. It is our wish that the Safe Space Initiative, or youth-friendly spaces, be sustained, and that there be evaluation to assess the effectiveness of such an important and life-changing program. We welcome the $154 million to reduce unplanned pregnancy and expansion of the contraceptive program. We are happy for the promotion of the menstrual hygiene by the First Lady. However, as we wait a report of the success of this program and look forward to the inclusion and scaling up of such programs to cater especially for the vulnerable and poor. As I conclude, Mr. Speaker. In conclusion, Mr. Speaker, the budget cannot be supported in its current form, as the small man cannot be the real man. The bulk of the population would not benefit from this budget 2022, which lacks a human face. The transformational approach posited and proposed by the senior minister in the office of the president with responsibility of finance allows the Guyanese to eat from the natural resource fund before there is any earning. Mr. Speaker, there's also no evidence of an exit strategy and no comprehensive plan to reduce the deaths from this COVID-19 public health threat. The budget feeds the rich, Mr. Speaker, and kills the poor. When is this government going to care about the people's welfare by being fair? The APNU-AFC coalition looks forward to taking back the helm of government to ensure that there is transparency, accountability, effectiveness in the public health sector, and overall, a good life for all Guyanese. Thank you very much.